Most men believe prostate problems are an unavoidable part of aging, something that just happens after 40, something you can't control. But as a urologist, I can tell you that while age plays a role, the real story is far more complex and far more hopeful. Your prostate health doesn't suddenly drop after 40 because your body gives up. It changes because of slow, predictable shifts in hormones, circulation, inflammation, and daily habits. And the most important thing to understand is this: many of these changes are reversible, or at least significantly improbable, when addressed early. The problem is that most men don't notice the early signs. They ignore subtle symptoms, slight changes in urination, waking up once or twice at night, a weaker stream, mild discomfort. These feel small, so they get dismissed, but clinically, these are often the first signals that the prostate environment is changing. After 40, one of the biggest drivers of prostate changes is hormonal imbalance. Testosterone levels gradually decline, but more importantly, the ratio between testosterone and estrogen shifts. As men age, more testosterone is converted into estrogen. This imbalance can stimulate prostate tissue growth and increase sensitivity to inflammation. At the same time, levels of a hormone called D8-dihydrotestosterone become more influential at the prostate level. D8 is necessary for male development, but excessive or prolonged exposure can contribute to prostate enlargement. This isn't something you feel directly, but over time it changes how the prostate behaves. Another major factor is inflammation. Chronic, low-grade inflammation becomes more common with age. It's influenced by diet, stress, sleep quality, body fat, and physical activity. The prostate is particularly sensitive to inflammation because of its location and blood supply. When inflammation becomes persistent, prostate tissue can swell, irritate surrounding nerves, and interfere with normal urinary flow. Circulation also plays a critical role. As men age, blood vessels become less flexible. Reduced blood flow means less oxygen and fewer nutrients reaching prostate tissue. Poor circulation also slows healing and increases sensitivity. This affects not only prostate comfort but also sexual function and energy levels, which is why many men notice multiple changes happening at the same time. Now here's the key point most men are never told. These processes don't happen independently. Hormonal imbalance, inflammation, and circulation problems reinforce each other. That's why prostate health often declines gradually, then suddenly feels worse. The good news is that the same interconnected system that allows decline also allows improvement. Let's talk about what reversing prostate decline actually means in medical terms. It does not mean shrinking the prostate overnight or curing disease through lifestyle alone. It means reducing inflammation, improving urinary function, supporting hormonal balance, and restoring better tissue environment. Many men experience meaningful symptom improvement when these factors are addressed consistently. One of the first areas to focus on is daily inflammation control. Diet plays a powerful role here. Diets high in processed foods, excess sugar, refined carbohydrates, and unhealthy fats increase systemic inflammation. This doesn't just affect joints or the heart, it affects the prostate as well. Shifting toward an anti-inflammatory eating pattern can significantly improve prostate comfort over time. This includes foods rich in antioxidants, healthy fats, fiber, and key minerals like zinc and magnesium. Hydration also matters, but timing matters just as much. Drinking most fluids earlier in the day and reducing intake close to bedtime can reduce nighttime urination. Physical activity is another critical piece. Regular movement improves insulin sensitivity, reduces inflammation, and enhances blood flow to the pelvic region. You don't need extreme exercise. Consistent walking, light resistance training, and stretching are enough to support prostate health. Sedentary lifestyles are strongly associated with worse urinary symptoms. Pelvic floor health is often overlooked. Chronic tension in pelvic muscles can worsen urinary urgency and flow issues. Gentle stretching, breathing exercises, and posture awareness can reduce unnecessary pelvic tension. This is especially important for men who sit for long hours. Sleep quality is another silent factor. Poor sleep disrupts hormone regulation and increases inflammation. Men who sleep fewer than 6 hours consistently tend to have worse metabolic and hormonal profiles, which indirectly affect prostate health. Improving sleep hygiene can have surprisingly positive effects. Stress also deserves attention. Chronic stress raises cortisol levels, which interfere with testosterone production and promote inflammation. Stress doesn't cause prostate problems directly, but it creates an internal environment where problems worsen. Stress management isn't optional, it's part of prostate care. Now let's talk about supplements, because many men ask about them. some supplements can support prostate health, but they are not replacements for lifestyle changes. Ingredients like zinc, selenium, saw palmetto, and pumpkin seed extract have evidence suggesting support for urinary symptoms in certain men. However, results vary and quality matters. Supplements should be discussed with a healthcare professional, especially if you're on medication. Regular medical checkups are essential after 40. Monitoring PSA levels, prostate size, and urinary symptoms allows early detection of issues. Early intervention almost always leads to better outcomes. Waiting until symptoms are severe limits options. It's also important to address body weight. Excess body fat increases estrogen levels and inflammation. Even modest weight loss can improve hormone balance and urinary symptoms. This is one of the most consistently observed improvements in clinical practice. Now let me be very clear about something. If you are experiencing pain, blood in urine, sudden urinary retention, fever, or rapidly worsening symptoms, these are not lifestyle issues. These require immediate medical evaluation. Prostate health education is about prevention and support, not self-diagnosis. For many men, the biggest barrier to improvement is not biology, it's awareness. Men normalize discomfort, they adapt instead of addressing the cause. But prostate health is not something you should silently tolerate declining. After 40, your body is still capable of resilience. It responds to better input. The prostate is not an exception. When men improve diet, increase movement, manage stress, sleep better, and monitor their health proactively, they often notice gradual but meaningful improvements: fewer nighttime bathroom trips, stronger urinary flow, better comfort, and improved overall vitality. These changes don't happen in days, they happen over weeks and months. That's normal. Health is cumulative. The most important takeaway is this: prostate decline after 40 is common, but it is not inevitable. And while you can't stop aging, you can absolutely influence how your body ages. If you take one action after watching this, let it be awareness. Pay attention to early signals, support your body instead of ignoring it, and work with your healthcare provider to stay ahead of problems rather than reacting to them. If this information was helpful, consider subscribing for more evidence-based men's health education. Informed decisions are one of the most powerful tools you have to protect your health as you age. Thanks for watching, and I'll see you in the next video.